Hello, we talk today about Ayurvedic perspectives on certain diseases. Today it's about hay fever. We're sitting today here at the Seva Academy in Munich, and there's Dr. Vijith with me. I'm very happy that you're here. Thank you.
Thank you.
And I would like to ask you if you could introduce yourself shortly about your studies and your education.
Sure. Namaste, I'm Dr. Vijith. I studied Ayurveda, the BAMS course in university, Rajiv Gandhi University of Health Sciences, Bangalore. And after my studies, I was in search of a traditional teacher, and I found my guru, who belongs to a very old lineage of practicing a classic of Ayurveda known as Ashtanga Hridayam. And I studied with him 2 years, observing his treatments, making medicines with him, and learning the scriptures with him for 2 years. And after which, I started a center in Kerala, which is nearby Cochin, called Vaikam, and I run a Ayurveda hospital there called Sri Krishna Ayurveda Chikitsa Kendram. And we are treating patients from all over the world. We have a lot of clients coming in from Europe, US, Japan, and South Africa.
Very international.
Yeah, and also from India.
Okay.
So we are making medicines for our clients within our campus by ourselves, and also for in-house patients we have specific food made for them. So it's a complete Ayurveda center by itself.
Wonderful. Okay. Today we wanted to talk about hay fever, and I would like to ask you: is there something simple that people could take care of if they have the disease, kind of hay fever? Is there anything, or?
Yes. So when we speak about hay fever or any such modern terminologies, the first thing is Ayurveda has its own diagnostic tools and diagnostic entities like disease names. So we need to re-diagnose this, what you call as hay fever, into Ayurvedic terminologies. So of course I also treat a lot of hay fever cases with good results, but the treatment given for maybe 2 different hay fevers are totally different, because the person is totally different. So when in Ayurveda, when we treat, it is not only the disease that we treat, we also treat the person. So a person who is old is totally different from a child. A male is different from a female. The physical constitution makes a difference. And also in a disease itself, which humor, which dosha we call in Ayurveda, is predominant, also makes a huge difference what kind of treatments. What level of imbalance is there? Now, hay fever, maybe even a person can die sometimes out of hay fever. Any disease can kill a person. So you say if a person's some vital organs are very compromised, like maybe liver or kidneys are very compromised, maybe this virus is sufficient, or this change is sufficient to even challenge his existence. So we cannot just generalize Ayurvedic approach on hay fever. So maybe you can ask me precise questions about that.
Okay, so it will be very individual how you treat it.
Yes, exactly.
So for example, I'm working a lot in the office. I'm stressed all the time. I have no time actually. And whenever I get out at a certain time of year, I go out and really right away my nose is running, my eyes are watering, and I have the feeling, okay, I actually have to stay home and shouldn't go anywhere out of there. What would you do? What could I do?
Yeah, of course. So I'm excluding your physical constitution, and I'm speaking from what you have asked me. So 2 things what I observe from what you told is that your way of work is sedentary, that you don't move very much, right?
Right.
So you sit in an office, maybe
Yes.
probably which is maybe either air conditioned, or you are sitting a lot, which is a
Yes.
kapha imbalancing causative factor by itself, right?
Okay.
And maybe I will then try to understand a little bit more about your food habits. Whether you snack in between while walking.
Definitely, because I have no time.
Yeah, and then I look at what kind of things you snack and how many times a day you eat, and how is whether you have hunger or not. So most of the time when I ask my patients whether you have hunger, then they start thinking, what is hunger?
Yes.
And they say, I have appetite for sure, but I'm not very sure about hunger. Can you explain me what is hunger? They ask me back, right? So, so most of the times, this is the problem, right? And when I look at the symptoms you explained, running nose and watering from the eyes, it's excessive fluidity.
Yes.
Excessive fluidity. In terms of Ayurveda, it is water element. Excessive water element which is increased, which is nothing but the kapha.
Okay.
Right, we call it as kapha.
Yeah.
So kapha means water and earth element in the body together is known as kapha. So the water aspect of the kapha has been imbalanced. So usually the reason of water element being imbalanced is the fire. The antagonistic to water is nothing but fire. When the fire is weak, naturally water predominates.
Okay.
So the fire in Sanskrit is called as Agni, which is the central of all treatments of Ayurveda. So we say the digestive fire, means the digestive strength or digestive power is the core of not only hay fever or any disease. So if your digestive fire is intact, you are healthy. If your digestive fire is impaired, you are diseased. If your digestive fire is destroyed, you are died. You are dead. And if you have digestive fire intact, you will live forever. This is not my statement. This is a statement from an ancient scripture called Charaka Samhita.
Okay.
Right. So this is the case now. So naturally then I have to look at why and how your digestive system and digestive strength is weakening. The factor what you told that you are sedentary itself is one of the biggest cause, right? Once you don't move.
But when I go outside at that time, I'm suffering.
Yeah.
So I just rather stay inside and do my work.
Yeah.
You know, and because I mean, usually in summertime I go biking and hiking and things like that. But at that time, I don't go out because it just gets more and more with the hay fever. Or the symptoms.
Maybe at that point, once you have imbalance of kapha and also a fever comes out, fever, or in terms of Ayurveda, no disease is your enemy, right?
Okay.
Every disease is an effort, a biological effort by human body to tackle an imbalance. So when excessive water element or kapha is increased in your body is trying to increase heat, right?
Okay.
That's what is fever. Body is trying to burn out or kind of dry off this excessive kapha by increasing the body temperature. That is what is fever. So at that time, once it has reached that stage, then we have to just obey what body wants to do. So in terms of Ayurveda, body treatment is nothing but subserving the immune system or assisting the life force, the prana, to do what it wants to do. Okay, you look at your system and say you find that your nose is running, eye is watering, you have slightly increased temperature. Of course, definitely you are not supposed to go out at that time. Then what you should do is, the best thing is fasting.
Okay.
Right? The best thing is fasting until you develop again hunger. Right? And you develop lightness. You feel clarity in your eye, in your nose. You feel taste. Until that, so once you have this stage, what you explained, of running nose, heaviness, or running from the eyes and slight fever, usually you lose appetite, you feel heavy, you are slightly febrile, you have fever. So the best thing is rest and fast and let the immune system or your own body, your Agni, regulate and burn off this excessive thing. Give a chance for the Agni to burn this excessive water. Don't put anything else. Especially don't take so much of liquid things. And fast. And once you start developing hunger, you eat very light things. Like maybe you can go for even something dry is the best. Maybe even dry, even bread or things like that. Or even in terms of, we have a lot of things at home, puffed grains like puffed rice, or that's the best puffed. Even I think you have rice crackers and puffed grains. Things are there. Yeah, which is light. When something is puffed, a grain is puffed, it is light and it is drying as well. So that will be better than even porridges. I'm not asking to take porridges because of this excessive liquidity in the body. Otherwise, when you come out of a fasting, porridge or rice soup, etc. is the best. But in this specific case, it's better to have something dry and light, and also small in quantity, and again wait until you again develop hunger. Maybe you rest like this and also have some simple herbs like ginger or cumin or some heating and drying herbs. Maybe probably better in the form of powder itself. It can be mixed with honey in small doses, muhurmuhu, like little by little frequently, not in big dosages. Maybe you make it into a paste and you lick it. You know, we have formulations like thali, sadi, churna, etc. in what we use classically, which is formulations. Thali, sadi, churna, or vyoshadi, vadaga, etc. formulations, which can be mixed with honey, and you can just lick it and slowly dissolve it in your mouth, so that it acts more in the oral cavity and in the upper respiratory tract, and it will slowly dry off this excessive kapha. So if you stay like that for a few days, and also along with some other simple medications, some tablets, powders, etc. will be good to begin with. So once you control this crisis of excessive liquidity, once the fever comes down, once this excessive oozing comes down, maybe then we can focus on long-term treatment plans, like some medications to improve your digestive fire. And maybe most of the times I also see that constipation is associated. Once the digestion is impaired, people can get constipated. And in terms of Ayurveda, when we look at constipation, it is an obstruction towards the downward flow of life, life. So once the downward movements are obstructed, things can come up. Right? This can also, so when we look at the side effects of constipation, or even side effects of holding the bowel movements or stool gang, they explain that even running nose can happen, headache can happen. If people just have the habit of not going to toilet when
because they don't have time.
For example, that can also be a cause of this. That precipitates as running nose, means because that downward movement gets reversed and it pushes things up. Then it can result in running nose, headache, and similar hay fever like things. So when we listen to a patient, we try to find out what all causes. If a person has the habit like this, maybe if we don't ask him to correct that habit, not to do this again, sometimes even after a short period of wellness, he will again have the attack. So this is the basic thing that a physician, Ayurvedic physician, has to work as much as possible to find out whether the food or lifestyle or simple habits like this is the real problem. For example, another very interesting thing is yogurt. I find, especially in people from Europe, that many people think yogurt is a very healthy breakfast or a dinner. I have even seen patients from Europe who take half liter of yogurt every night, thinking that it gives them a lot of nutrition and their bones will be very strong. They have their own arguments about this, but specifically yogurt is contraindicated at night, right? So, and also it's very bad to mix yogurt with fruits. So we know in the market almost you cannot get for yogurt without fruits now in Europe. Almost, yeah. Or it has almost reached there. So so all these habits, once we change and we find out what all causative factors is there, and once the person comes out of this crisis, so if sitting a lot, not going out is the reason, we will ask him to even go out or do exercises and to change the food habits, adapt something drying and light, and which improves digestion and down bowel movements.
So that I won't have it next year so hard or so much, or not even at all. I have to look at my digestive system, especially, so that I really look for my nutrition, what is right, what is light, in that direction, and so that I can prevent myself from getting it again.
Yeah, definitely. And as why I asked how is your hay fever, because I have also seen hay fevers presenting with skin rashes.
Yes.
And with itching and with slightly pitta and blood. Pitta means it's like a fire and water element imbalance, and also imbalance of blood, so which is a little bit more deeper than what you told, which might need a little bit more intense medications and a little bit more of care once it goes towards that, right? So the same disease, it can be the same agent in the same season. Also spring is the time when hay fever comes up. In terms of Ayurveda, when we look at spring, it is the time of imbalance of kapha. So winter, how the snow is formed outside, the water content in the body is getting an earthy state. Snow is an earthy expression of water, right? Earthy, nothing means solid. So snow is a solid expression of water. So the same thing happens in the body. The excessive water element is accumulated in the body, but in a solid stage. And in spring, when the atmospheric temperature increases, how the snow melt, in the same way the kapha also gets melted, and it comes out, as you told. So Ayurveda says you should not try to block it, let it come out. So even what we prescribe in terms of intense treatment is Vamana, inducing emesis, trying to, you just observing what body is trying to do. Body is trying to drain the excessive kapha, you make the person to vomit it, so that the whole, so according to Ayurveda, the region above heart is the seat of kapha. So when somebody omits, the whole lungs, throat, the head, everything is squeezed and the kapha is drained out. Also nasya, some nasal medication, some intense sharp medicines used as drops or powders into nose, and the person spit out a lot of phlegm. So we try to drain this excessive kapha out of the person. So in a way, hay fever is a normal expression now, like how the snow in the mountain melts and the rivers get sometimes flooded or full in the spring. In the same way, the same thing is happening in human body at that time. And this happens when you go to nature, you go out, as you told. This is why going out makes it a little bit more intense. But we cannot see it absolutely as a problem. As I told, every disease in the eye of Ayurveda is a great chance to react to some imbalance inside. Or in other terms, I would say, a person who doesn't get a fever once in a year has a very bad immune system. Some people tells me, I'm very healthy so that even I don't get a fever. I tell it's something very serious. You have to be very careful. I've seen many people who have this character getting heart attacks, renal failures, Or in terms of Ayurveda, we have to understand that the humors, the doshas, are going deeper. Fever or vomiting or diarrhea is a very superficial and a very good way of reacting, right? If a person doesn't have any of these kind of responses, even
it goes deeper.
We have to understand that it is going deeper. It's not coming to the surface. Body is not able to push things out, right? When we eat something bad, you vomit. It's the best thing, right?
To get it out.
To get it out. If you don't, you have a diarrhea. You have a loose bowels. To push it
worse,
out. Right. That's the second chance. If none of this happens, you might have a fever, right? Where body is trying to burn this inside. Even none of these three things happens, where should it go?
Right, into the body.
Into the body, right? So something which is harmful for the body, which cannot be accepted by the tissues, which cannot be utilized by the body. If body detect that, if it comes out through skin, if it comes out through nose, mouth, eyes, it is the best. Don't stop it. Don't stop it. Is there. Let it come out.
Okay. Thank you very much. So I think what we definitely learn is that every sign that our body gives us has a reason, and we should notice it.
Yeah.
And we can learn from it.
Definitely.
Okay. Thank you very much, Dr. Vijith. Thank you.
Namaste.